Welcome back to the next rhythm challenge. So here we have another rhythm, present here. Okay, and it says name the following rhythm, choose the best answer. Our four answer choices are sinus tachycardia, A, atrial fibrillation is B, atrial flutter, C, or junctional tachycardia, D. Okay, again, just to orient yourself, we have two rhythm strips down here taken from our standard 12 lead. Okay, this is the limb lead, all right, inferior limb lead, lead 2, and one of our right precordial leads, V1. Down here we have the large portion of those above rhythm strips, okay? So what I want you to do is look at the rhythm strip, try to choose the best answer, and when you're ready, restart the video and we'll go through this together, okay? All right, so hopefully you had a chance to take a look at this and choose one of these four answer choices. All right, so again, we always want to understand not only what the right answer is and why it is, but also why the other ones are not correct, okay? So one of the best ways we'll do this is by kind of going through each one of them and then looking at the rhythm strip. So let's do that here. So sinus tachycardia, okay, things that you want to keep in mind with this is that it's a sinus rhythm, so that we have normal sinus P waves, okay? We're showing lead 2 here, so we want to see upright P waves with similar morphology, and in V1, we may see biphasic P waves, okay? That's something to keep in mind. Now, why is that? Well, because the P wave axis goes between 0 and positive 75 degrees, okay? So that's normal P wave axis. Remember, lead 2 sits here at positive 60 degrees. Tachycardia, okay, or other things of sinus rhythm we should keep in mind. Normally, this is a regular rhythm, okay? You can have sinus rhythm with it being irregular, but that tends to be with a block, okay? Now, tachycardia, that means that we have a fast rhythm, so over 100 beats per minute, okay? Things to keep in mind. Again, tachycardia over 100 when we're talking about our adult patients, and make sure you're assuming that unless I tell you otherwise. Now, choice B is atrial fibrillation. Okay, in this case, we actually don't have P waves present. Remember, we have chaotic firing of the atria. Okay, so we can have fibrillatory waves, but no true P waves. Okay, so they're indiscernible P waves present. We have an irregular rhythm. Okay, and when we just have regular atrial fibrillation, the rate we tend to call between 60 and 100 beats per minute. Now, if it's atrial fibrillation with SVR, slow ventricular response, that's less than 60. If it's AFib with RVR, which is rapid ventricular response, that's over 100. Okay, so things to keep in mind. Now, atrial flutter, what you can see with atrial flutter is, again, no P waves, but you can see what we call flutter waves. Okay, the other thing is it could be it's often a regular rhythm, okay? So regular flutter waves we see. You can have atrial flutter with an AV block or variable block in which you have varying QRS complexes, okay? So that's one thing to note. But the flutter waves tend to be regular, okay? Next, we have, and again, that's the rate tends to be between 60 and 100. You can have fast rates with that as well. Now, junctional tachycardia, okay? So again, junctional rhythm, all right? Meaning it's occurring from that AV junctional area, okay? So we have the absence of P waves here, all right? And what else do we have going on here? Well, we have narrow QRS complexes, all right, oftentimes, unless it originates low, but oftentimes you have narrow QRS complexes, and it's a tachycardia. So another thing is it's a regular rhythm and a tachycardia, so over 100 beats per minute. Okay, so hopefully that makes sense there. Okay, all right, so let's go through these rhythm strips here. So we have lead 2, and notice what you see here. You have these peaks that are pretty much popping up through here. Okay, and what are those? Okay, those are what we call flutter waves. Those are not P waves that we're seeing, even though they're upright, as we said in lead 2. Those are not P waves. We have multiple of those same things happening. So, as we already mentioned, flutter waves, this should clue you in that this is atrial flutter. Okay, so again, albeit you'll find out that these intervals are between here to here, okay, are the same. that if you measure them throughout, okay? All of them here. So that's a regular rhythm, as we mentioned here. Okay, it has those flutter waves, and those are no P waves. So no P waves, that's why it's not sinus tachycardia. Okay, so that's one thing to know. And notice that the flutter rate, okay, is about 300 beats per minute. It's about one of those big boxes in between. Okay, so 300 over 1 is 300 beats per minute. It's not atrial fibrillation because clearly if you look at the QRS complexes, so from one R wave to the next, this is our R to R interval, you measure it to the next one, you would see that these are relatively the same. Okay, so this is not an irregular rhythm. Okay, so that's one thing to keep. This is not atrial fibrillation. And it's not a junctional tachycardia because you actually see those flutter waves. So you have some rhythm coming up from the atria, and it's only sometimes that we're seeing conduction through. So we do have no junctional rhythm, okay? So there's no P waves. We have narrow QRS complexes. It is regular, but these are flutter waves that we're seeing. So junctional tachycardia is not correct, okay? And the other thing is if you were to look at the ventricular rate here, if you looked at this one and found the next one, you'd see that there's 1, 2, 3 over 3. So 300 over 3 is 100, but it's a little beyond that, so it's less than 100. So it's not a tachycardia, okay? So this is atrial flutter, and what we want to look at here is this is a macroentrant circuit that's often taking place in the right atrium. So what we have here are these flutter waves, okay? And if you look down here, here's a flutter wave, here's another one, okay? There's one that follows here, okay, and precedes this one, and there's actually one that's occurring right here, okay? So pretty much you have these flutter waves that are almost sawtooth pattern going right through, okay? So that's pretty much what you have. Notice that this here, okay, does not look like these two that come before it, okay? If you look up here, notice that this end portion here looks a little different, and that's because it's being obscured by the T wave. So notice this portion here compared to these two look the same, okay? And what you have hiding within this, so not only is the T wave obscuring this, but the QRS complex is obscuring another one, okay? So if you were to follow this through, you would see that that comes down like that, okay? So in fact, what we have here, if we were to count these out, we have one that's occurring here, we have another one, so that's 1, 2, 3, and a fourth one, okay? So you have 4 flutter waves and 1 QRS complex. So what do we call that? We call this atrial flutter, okay, with 4-to-1 AV conduction. So that's actually what it's called, and remember that 4-to-1 is the 4 flutter waves that we saw here in the 1 QRS complex, okay? Now it can be variable, and we would call that atrial flutter with an variable AV conduction, but we don't see that here. If you look at them all throughout, you have a regular flutter that's going on here, atrial flutter, with 4-to-1 AV nodal conduction. Well, that's the end of this lecture. I hope you learned something.